Imagine living with a fire inside your body that no one else can see. For 1 in 10 women, this isn't an imagination. It's a daily reality called endometriosis. It takes an average of 8 years to get a diagnosis. 8 years of being told it's just a period, or it's in your head. Today, we are spending the next few minutes performing a deep tissue investigation into the biology of this condition. We are going to look at the immune system's failure to clear these cells, the estrogen loop that keeps the inflammation burning, and why some women have silent endo with no pain at all, only discovering it when they face infertility. Welcome to the masterclass that finally explains the why behind your pain. To understand why endo happens, we have to look at the retrograde menstruation theory. For decades, doctors believed that menstrual blood simply flowed backward through the fallopian tubes. But here is the biological flaw in that theory. 90% of women have backward flow, but only 10% have the disease. This brings us to the immune dysfunction theory. In a typical body, natural killer cells and macrophages act as a cleanup crew. When cells from the uterine lining end up in the pelvic cavity, the immune system should identify them as being in the wrong place and dissolve them. In women with endometriosis, that cleanup crew is effectively blinded. The immune system fails to see these cells as invaders. This allows the tissue to seed itself onto the ovaries, the bladder, and the bowels. Once seeded, these lesions do something remarkable. They begin the process of angiogenesis, which is the creation of their own blood supply. They aren't just stray cells anymore. They are living, growing islands of tissue that respond to your monthly hormones, just like your uterus does. Why does endometriosis keep growing, even with treatment? It comes down to a process called aromatase activity. Normally, the ovaries are the primary producers of estrogen. But endometriosis lesions are clever. They contain an enzyme called aromatase, which allows the lesions to produce their own estrogen. This creates a feed-forward loop. The lesions produce estrogen. The estrogen causes the lesions to grow and bleed, and that bleeding causes massive inflammation. This inflammation then triggers more aromatase activity. This is why many women find that standard birth control doesn't fully stop the pain. It's because the lesions are making their own fuel regardless of what your ovaries are doing. This inflammation also creates adhesions. Think of these as internal scars or biological superglue. They can fuse your ovary to your pelvic wall or pull your fallopian tubes out of alignment. This isn't just a period problem. It is a structural and metabolic battle happening inside your pelvic floor. One of the biggest questions we get is, how does endo stop me from getting pregnant? The answer is more complex than just blocked tubes. It involves the follicular fluid environment. When you have endometriosis, the fluid surrounding your developing eggs is often flooded with inflammatory proteins called cytokines. This creates oxidative stress, which can damage the delicate DNA within the egg before it even leaves the ovary. Furthermore, we have to look at the window of implantation. The same inflammation that causes pain also changes the soil of the uterus. It can lead to a condition called progesterone resistance. Even if a perfect embryo is created, the uterine lining may not hear the signal from progesterone to become sticky and welcoming. This is why many fertility specialists now focus on cooling down the body's inflammatory response for months before attempting a transfer or natural conception. Understanding this toxic environment allows us to stop blaming our luck and start treating the biology. The biochemical fire, aromatase and prostaglandins. To truly understand the pain of endometriosis, we have to look at the chemistry of inflammation. It's not just that the tissue is growing where it shouldn't. It's that this tissue acts like an independent endocrine organ. These lesions produce high levels of prostaglandins, which are the same chemicals that cause normal period cramps. However, in an endo patient, the levels are often 10 to 100 times higher than normal. This creates a state of hyperalgesia, where the nerves in your pelvis become hypersensitive to any movement. Because the lesions produce their own estrogen through the aromatase enzyme, they essentially feed themselves. This means even if you are on medication to suppress your ovaries, the fire of the endometriosis can continue to burn because the lesions have become their own fuel source, independent of your central hormonal. The physical architecture of pain, adhesions, and organ tethering. Beyond the chemical pain, there is a structural battle happening. As the body tries to heal from the repeated monthly bleeding of these lesions, it creates scar tissue known as adhesions. Think of these as biological superglue or spiderwebs that are incredibly strong. These adhesions don't just sit there, they pull. They can tether the ovaries to the pelvic side wall, or worse, fuse the uterus to the bowel in what surgeons call a frozen pelvis. Every time you move, stretch, or digest food, these adhesions pull on your internal organs, which are rich in nerve endings. This explains why endometriosis pain often isn't limited to period cramps, but can manifest as endobelly, bloating, painful bowel movements, or shooting pains down the legs. We aren't just dealing with a hormonal imbalance, we are dealing with a physical restructuring of your internal anatomy. If you are watching this and feeling seen for the first time, know that your pain is real. The path forward involves finding a specialist who understands laparoscopic excision, cutting the disease out at the root, rather than just burning the surface. It also involves an anti-inflammatory lifestyle that supports your liver's ability to clear that excess estrogen. You are your own best advocate, and knowledge is the first step toward healing. Thank you for joining us at Health Explained Simply. Subscribe to join a community of women reclaiming their health through science.